healthcare deal. Dick is a purveyor of the very fine website, dickmorris.com. So what say you, Morris?
In the Senate, yes. In the Senate, he's going to get 51 automatons to walk the plank for him and to approve this through reconciliation. In the House, I don't know. And the reason I don't know is that it's up to you, the viewers, to make that decision. Right now, as things are set, the party discipline in the House will be enough to pass this bill. But if the forces that derailed it and elected Scott Brown get activated in the next week or 2 weeks and understand the stakes, they can pressure the swing Democrats. And on dickmorris.com, I have a list of all 30 of them with their phone numbers. And if they do that and if they do other things to influence those members, I think they can be scared away, and I think this bill can be defeated. It is right in our wheelhouse. Right now, the people opposed to this bill have got to make the decision as to whether or not it passes by their level of activism. And by the way, let me say that the stuff Carl was talking about the high taxes from the bill, that's minor. The taxes go up, go down. What is major about this bill is that it gives the federal government the power to tell people, no, you can't have this bypass surgery. You have to die. And unless we have some Lazaruses walking around, we're not going to be able to resurrect them after Obama's defeated.
I got to disagree with you a bit on the taxes, though. When you're into the Medicare, the hike on not only on straight income, but on capital gains, on rents, on anything like that.
It's a disaster for the economy.
Enormous.
But money is money. Life is life.
All right,
this bill
but
is
we don't
euthanasia.
know. It's not fair. And so you're doing the same thing I said in the Talking Points memo that Bernie Sanders is doing about global warming. You're trying to scare people that if they get a heart attack, the government's going to let them die. That's what you're trying to do. Now, you may be right.
And it's right.
Well, you say it's right, but they say it's wrong. They say no.
Bill,
you say yes.
Bill, if you come to the doctor and you say, I want bypass surgery, or he says you need bypass surgery, or you need a heart transplant, they have to assess whether to give you the care according to this
how
bill
old you
based
are.
on qualities,
Quality
adjusted life years. 90, 80 years old, diabetic, high blood pressure, overweight, no. And I'm sorry, that does mean you're going to die.
Okay, but I don't know if most Americans are going to oppose that. I don't know if they're going to oppose a heroin addict walking in with a bad liver who's 68 years old, and they're going to say, look. So I'm not sure that that is going to do it. What does it for me, Morris, what does it for me, and I'm trying to be as fair as I can, as you know, is the unbelievable cost to the nation of this bill. Because I don't believe for a second it's $1 trillion bill. I think it's at least $2 trillion. I think they're going to suck the blood out of the working American to pay for the entitlement. That's what's put me over. Go ahead.
My next book comes out in 2 months called 2010, and in it I claim this bill costs $6 trillion.
But you're trying to scare everybody, Morris. You're even scaring me.
I'm giving you the facts.
What?
Hey, man, I'm giving you the facts.
You're giving me the facts from your point of view.
I'm giving you the numbers. $1 trillion is the 6-year cost and the 10-year revenue balanced out. But from the minute the benefits start in 2014, and you run that to 2024, that cost is $2.5 trillion, according to the Congressional Budget Office. And the rest of the cost is that I make you buy an insurance policy from Joe over there. And that's going to cost you money in writing out a check for premiums. And I'm going to make you cover the cost of people that didn't buy insurance. And when you put those together, you're talking about $3 trillion of premium hikes over that 15-year period. And those are not scare tactics.
I'm not saying that you're wrong. But the other, well, I can get in somebody from the other side.
I tell the truth, and you just call it scary.
I can get somebody in from the other side. Oh no, this is nobody knows how much the bill is going to cost if it gets through. Nobody knows. What I do know is it's not going to be $1 trillion, and I also know that taxes are going to go through the roof, and I also know that premiums aren't going to come down because they haven't come down in Massachusetts. They went up. Okay, so I know what I know based on what's real. I can't project out. Now, final question. I think this tomorrow is it kabuki theater, as Rove said, or is it high noon, as O'Reilly said, with the Clantons and the Earps and this and that? I think it's an orchestrated deal on both sides.
I think it's the Romeo and Juliet, the two families fighting. Going.
Will there be a winner, a clear winner tomorrow when the dust settles?
Yeah. Obama has a very high bar, far too high for him to make it, which is that he has to convince people that a plan they've rejected they should accept. He's not going to be able to do that. The Republicans have been pasted by Obama for 3 months of saying all you are is the party of no, you're not for anything, you have no program, and all the Republicans have to do is put out a plausible plan, which they will, and that'll satisfy everyone. Most important part of that plan is coverage, a pool to cover really sick people. So no one who really needs it doesn't have health insurance.
Okay, a separate pool for those who have the pre-existing conditions.
Yeah, like bad drivers pool, you know?
Okay, Dick. Thanks very much. We appreciate it. Plenty more ahead as the Factor moves along.